If you are currently preparing for your UK NMC OSCE exam, then you need to watch this video to the end as I break down the 4 parts of your OSCE exam and how many specific stations from these 4 parts will collectively make up the 10 stations you are going to be assessed on your OSCE day. Let's start with the API stations. This is a collection of 4 individual stations that come together to form the API stations. So you have the assessment as the A, and then we have the planning, which is the P, implementation, which is the I, and the evaluation, which is the E. So these are the 4 stations that make up the API stations. However, for nursing associates, they are not going to have the planning as part of their API stations. Therefore, nursing associates will have the AI stations, which is assessment, implementation, and then evaluation. Now, what is the expectations for the assessment, planning, implementation, and evaluation stations? For assessment, what you're expected to be able to demonstrate is your ability to do an A to E assessment on a patient and then be able to complete a news 2 chart for the patient. This is in respect to adult nursing. You may have to complete the GCS chart instead of the news 2 chart. And so that is the expectation for assessment. For planning, you are expected to identify 2 problems from this patient's complaints and write a care plan for the problems you have identified. Don't forget that you need to prioritize these 2 problems you have identified. For implementation, you are expected to administer an oral medication to your patients. You are expected to go through the prescription and observe the patient's rights to medication and then administer those medications effectively. For evaluation, the expectation is that now patient is due for discharge or patient is due to be transferred out to a different unit. Therefore, you need to hand over the patient's care to a doctor who is receiving or to a nurse who is receiving the patient from your unit. Or you can also be asked to hand over the patient's care to your colleague who is coming to take up from you. And so these are the 4 stations that make up the API stations. For nursing associates, you are not going to be doing the planning. However, the assessment, implementation, and evaluation stays the same. The next one we need to talk about is the skills stations. And so don't forget, we've covered 4 stations for the other healthcare professions and then 3 stations for nursing associates. Now we are left with 6 additional stations for the other healthcare professions, including nursing, midwifery, mental health nursing, children's nursing, and then we are left with 7 stations for nursing associates. For the skills stations, you're going to have 4 individual stations under the skill stations to add up to the 4 stations of the API stations, making up 8 stations for adult nursing, midwifery, mental health nursing, and then children nursing. However, for nursing associates, you're going to have 5 additional stations to add up to your assessment, implementation, and evaluation stations, making 8 stations. The skill stations can be any nursing skills that you can think about. Can be giving IM injection or administering suppository medication, or maybe completing a fluid balance chart or doing a pressure area assessment. Now, this is what you need to know about the skill stations. The skill stations have 2 parts. We have the performing stations and we have the non-performing stations or the silent stations. This is what it simply means. Performing stations are the stations you need to perform to the assessor. You need to demonstrate to the assessor, and the assessor is going to assess you based on how well you've been able to present and also demonstrate your skills. However, for the non-performing stations or the silent stations, you're going to have an allocated time for a task, such as completing a fluid balance chart. You don't need to communicate to the assessor. And so that is one example for the silent stations. So you could have 2 silent stations, or you could have 1 silent station and then 3 other performing stations. But in total, just as I said earlier, for nursing associates, you're going to have 5 stations where you have some silent stations and then performing stations. And for the other healthcare professions, you're going to have some performing stations and non-performing stations, making up 4 stations. So now that we've established 4 additional stations to the API stations and then 5 additional stations to the AI stations for nursing associates, let's look at the 2 additional stations that is going to make up 10 stations for all the healthcare professions. Now, the third aspect of the 4 parts of your OSCE exam is the evidence-based practice. The evidence-based practice station is also classified as a non-performing station or a silent station. Based on the scenario, you will be provided some bullet points from recent findings of academic articles or studies. And so what you need to do is, based on the provided list of findings, you are supposed to use that to educate your patient in writing. So you need to write a number of points based on the bullet points that has been given to you in relation to the scenario. The last section of the 4 parts of your OSCE exam is the professional values. Professional values is also classified as a non-performing station or a silent station. For professional values, you will be given a scenario, and then based on the scenario, the NMC wants you to communicate in writing what you're going to do when that scenario happens. And typical example could be that a colleague of yours comes to work and then you find them and then you find out that they are drunk. What would you do in this situation? Don't forget that all the answers and how to go about all these stations are provided in the OSCE marking criteria, which is on the NMC official website. So in total, these are the aspects or the 4 parts of your OSCE exam that is going to make up the 10 stations you are going to be assessed on your OSCE day. In my subsequent videos, I'm going to discuss the specific stations you need to expect for all the 4 parts of your OSCE exam that makes up the 10 stations. Don't forget to leave some few likes and share to a colleague who is currently preparing for their OSCE exam. See you in the next one.